Hello, it's Ariel. So, I just wanted to tell you a little about a book that I found. This book is called The Epilepsy Patient and Family Guide. This is the third edition. This is the second edition. I ended up with both because I couldn't find this one for a while and I had to get another one. Well, this book is by a guy named Orrin Devinsky, who is now, I believe, one of the editors of Epilepsy.com. He's definitely in the Epilepsy Foundation, working with them now. And his information is very good. The main thing that I like about this book is that it has so many different areas that it covers. The idea in this book is to help you figure out how to live with epilepsy. So it's different. It's like also for your family members and friends or partners and yourself. So it's covering all these different topics that can really help with your life. For me, the biggest thing that I got out of it was actually because there's information about simple partial seizures in here that are descriptions of them, and I had never known that's what was going on with me. And then I read that and I figured out what they were. So for me, it was that I discovered that I was having partial seizures, as well as I used to have tonic-clonic seizures till they are now controlled with medication. My partial seizures were not controlled with medication, though, but I did not know I was having them. I knew that something was happening. I didn't know how to explain it, and it was really, really scary, but I didn't know it was a seizure. So finding that out changed my life. I really hope that this book can be helpful for other people, because not only was it good to hear about that, learn about those seizures, but also one of the things that I really like is that he talks a lot about different specific things that you can learn, but also broader subjects. Like there's, things like an overview of epilepsy, there's first aid, stuff like that. But then there's also medication, all about, medications, which ones you use first, when, how many. And then there's also, things about the diagnosis of epilepsy. And then the things that I think are really helpful is that he talks more about things with life. So he talks about also the first seizure. So if you just have epilepsy, read this book, because especially if your kid or somebody has epilepsy, because I was 12 when it happened, and I went through so much in my teens that I did not know what was going on. And in this book, it's really great because he talks about epilepsy in childhood, infancy, childhood, adolescence, adulthood, later in life. And he talks about women and epilepsy as in contraception, having pregnancy, menopause. And then my thing that I found the most helpful, which is mental health of adults with epilepsy. A lot about the connections between depression and epilepsy, psychosis and epilepsy, unusual seizures, anxiety, treatments for depression that work with having epilepsy. Then there's information in here about, more on the meds that we have, resources, and stuff on more things about mental health and stuff with epilepsy in terms of quality of life, like living with it. So that's a big one. The quality of life aspect is really important. I never knew that technically when I went and talked to my first epileptologist, because I had seen multiple neurologists and it hadn't worked out in terms of getting the things really controlled well and feeling good, because I did have my tonic-clonic seizures controlled eventually by one of my medications, but the problem is that it was making me super depressed, and I didn't know and causing lots of other side effects. I didn't know what to do about it because I was afraid to change to a different medication because I was afraid it wouldn't work, and then I would go back to having tonic-clonic seizures, which were really scary, and I really didn't want that, so I didn't try another one. But it really helped when I saw this new epileptologist, and they said, a drug is not efficacious unless it stops your seizures and is tolerable, is not horrible side effects, that you can live with, where you still have a good quality of life. And so I've tried many meds now, and many epilepsy meds, And so at this point, I have found two that work for me and that I tolerate. There's one or two other ones that do work, but I really can't take them. And then the rest of them just don't work for me. So I'm on those two that that actually work for me right now. But it really is better to be on ones that you can tolerate, because you have to keep trying. It's really a hard thing. But in here he talks about surgery. He talks about, like I said, also just, education, like people who have, when you have epilepsy, how do you deal with things like, schools and then insurance companies. And so there's everything you can think of in here. And for me, the best part was reading patient descriptions of seizures, because that was something I'd never read. So one of the things that I'm really trying to do here in this channel is to talk and teach people about different types of seizures and their descriptions, so that they might realize if they have other seizures than what they know they're having, that you could find it out. So that's what this book helped me to do, and that's what I hope other people can get from this.